So I can start. What we saw from this sub-analysis, which looked at pre-study data or baseline data, uh, very few children in our sample received asthma specialist care, despite national and global recommendations that reinforce the importance of specialist care. All of the children that were enrolled in the study met criteria for uncontrolled asthma, and national global guidelines suggest or strongly encourage that these children should be seen by an asthma specialist. But, we saw there were, unfortunately, few children that were seen. We saw that a little over a third, or 37%, had ever, reported ever seeing a specialist in their lifetime, and only 16% saw a specialist in the past year. So much lower than, we would like for sure.
Yeah, and to add on to for marginalized groups, that our population taking place in Rochester, New York, more than half of our population was Black or identified as Black. So 58% had all identified as Black, but only 39% of the sample that had seen a specialist were Black. So it was much less than we had anticipated based on the population that we looked at. Yeah, so for some demographics based on who saw a specialist versus who didn't, it was things like children who saw a specialist often came from multiple parent households. So like they had married caregivers, they had higher education. So most of their caregivers had education levels that surpassed like a high school diploma or a GED. They also came from households that had a greater income level, so above 30 or at or above $35,000 per year. And more often, these children that saw specialists were often younger and identified as Hispanic as well.
Yeah, and I'll add this, this does, align with what's in the literature on, social determinants of health, things like income, living environment, that very much contribute to healthcare access. So, this, I think, just reinforced, what's kind of already been in the literature on this population and their reduced access to healthcare services.
Yeah, so what's important about this study is that all of it is caregiver reported data. So we don't have any information from like medical offices, either primary care or specialist offices, about primary care referrals. So it does come into play whether or not the caregiver were aware that they were receiving a referral from their primary care doctor, or that they knew what to do with the referral afterwards. However, we did see that based on caregiver report, it did seem that the primary care referrals did play a large role. So whether or not they were or had knowledge of being referred to a specialist did increase their odds of having seen a specialist in the past year as well.
Yeah, I think there's definitely, a myriad of factors involved. Going back to social determinants of health, that certainly contributes to a lot of these care barriers. I think also knowledge and awareness of asthma specialists, both, among primary care providers and patients and families. I think there could be room for more education there on the role of specialists and their expertise in managing this condition. And, I think a lot of it also goes back to communication and health literacy as well, which Rachel was alluding to. So I think there's definitely room for improvement in a lot of those areas.
Yeah, so like we had mentioned earlier, for the families or the children who came from families that had seen specialists, they often came from households that did seem to have more resources. So they had higher income levels overall, they had higher education levels overall. And so it does seem like there may be some resource gaps in not only what is accessible to you, but what is accessible to you. So I think a lot of it really has to do with communication, being able to talk to multiple different facilities, talking to different providers, different community members as well. So I think there's a lot of different gaps, like Emily was just saying about different like knowledge levels and knowing who you can reach out to. So I think with the ones that had seen specialists, it seemed like maybe they had some more resources that were available to them versus the groups that may had not seen a specialist.
Yeah, so we surveyed